Medicare for all now. Good morning. This is Tom Dillon, the Lifetime Liberal. Today is Friday, July 10th, 2026. And yes, the title of this rant is Medicare for all now. Now, about 2/3 of Americans believe that we all should go to Medicare for now. And I want to bring this up now as we are in the election cycle right now, because we need to get as many people as possible out there to vote, to get rid of as many Republicans as we possibly can, so that things like this may be enacted as we get into 2027. And the reason I say that is there's going to be terrible pushback, because Medicare for all will be something, and the Republicans have already decided that everything that the Democrats are doing is communist and socialist. And Medicare for all is one of those things that they're going to hype on all over the place. But remember, we have hundreds of thousands of people every single year declaring bankruptcy because they can't afford their medical health care. And while, 28 or 29 of the next industrial countries in the world all have a single payer, universal health care, something in that regard, and none of them have to declare bankruptcy because they couldn't pay their medical bills. Okay, and then we also have things like, insulin costing a heck of a lot more than $35, which Biden had wanted to do. And it doesn't also account for all the people who have suffered immeasurable financial insecurity because they didn't have enough health care to cover for it. So let's just talk about, all right, so let's just say, hey, we get enough people to vote. We have voted out a lot of Republicans. We have a majority of the House. We have a majority of the Senate. That doesn't mean things are going to get passed right away because the Republicans can filibuster in the Senate because you need 60 votes, etc. But let's just say we start working on this type of legislation to make things try and happen, to get things to move. Now, I could make the example, like I said, I'm a liberal. I'm a liberal capitalist. I believe people should make money. I believe doctors should make money. I believe people who are inventing and designing drugs to help the American people and to help people all over the world for terrible conditions, they should make money. Yes, I believe in all of that, and they should make a good amount, but they shouldn't make gobs and gobs and gobs and make people have to suffer and have to die because they didn't have enough health care, because they had to declare bankruptcy and all that other stuff. So I'm all for that, but we can do some things. And the question is, once we get into there, how long will it take? It could take years. It could take, Obamacare, the Affordable Care Act, it was imperfect right from the beginning. It hasn't been improved on. It has actually been made a lot worse, but it allowed, I believe, up to 30 million. It went from 30 million down to about 12 million people who were unemployed lacked health insurance in the United States. So it was imperfect from the start. The Republicans wanted to get rid of it from the start. Trump said that, every 2 weeks he was going to come up with a new thing. It never happened. Same with infrastructure. Every 2 weeks, nothing happened. It got voted down in the Senate when John McCain did his famous, yeah. So and everyone's going to have a say in it. And that means Republicans are going to say it. Corporate Democrats are going to have a say in it. There's a lot of money out there, a lot of money in the pharmaceutical industry, a lot of money in the hospital industry, a lot of money in the insurance industry. You think they're going to take any of that standing down? No, they're going to fight like heck all over the place. And let's just put in an example here. So Washington, D.C. is just littered with thousands upon thousands of lobbyists. Many of them in those industries that I just mentioned. They're making hundreds of thousands of dollars a year. It doesn't make any difference what industry they came from, and they play a part in keeping costs high for us. And they know how to work a particular congressperson or work a particular senator and they know how to pull their buttons, especially in the territories that they are representing. So this is not going to be an easy process. It's going to be a long process. And one question would be, hey, what can we reasonably expect in the first year? Can we expect 10% change? So that we're now 10% more towards Medicare for all? Can we get a 25% change? Maybe even a 50% change. Maybe we can do a lot of stuff. How soon can it be done? How quickly can it be done? Remember, it's not going to be easy the first time. It's going to take a little while. I remember something wasn't in Obamacare before it came out. There was a software glitch. And of course, Republicans screamed bloody murder all over the place. We got to get rid of it. And of course, let's just also bring in one other quick thing. about, let's just say, the insurance companies who are gouging people all the time. But you can apply that to the hospital industry. You can apply that to pharmaceuticals, et cetera, where the insurance companies basically have designed answers for somebody who might have a particular type of condition to override a doctor's prescription that they get, either some type of medicine or some type of procedure. So they physically want to overrule doctors so that they can make more money. And they have answers already written up so that people are denied healthcare coverage over their doctor's opinion. So we need to change. We need to change fast. But there's going to be big pushback all over the place. And they have to, and I want to point out another thing. Suppose you get a 10% difference. You get 10% better in terms of going towards Medicare for all. And I don't know, whatever thing it can be in. Sometimes people have to make votes. And this is why you have to have a thin skin when you're in Congress, because sometimes you have to take votes that, it's just a little bit better than what you wanted. I mean, it's a little bit more than what's out there, but you can't get any more right now. You can get more maybe later on, but you can't get any more right now because there's horse trading, there's give and take, and that's the way Congress works, and that's the way it's going to be. But if you could get 10%, would you take 10%? Because I'd say yes, take the 10%, and the next day you go after it again and get the next 10%, and get the next 10%, and get the next 10%. It is going to be a battle the whole way through. Just getting enough getting people in Congress, both the House and the Senate, to be Democrats, to get this type of stuff rolling is just the beginning. The warfare then begins right after that. And the warfare begins right when the documents are signed to make Medicare for all available, let's just say, so that you get 10% better and then 10% better. It is going to be ongoing. It is going to be unending. And it is a fight worth fighting. The American people deserve this. We need to move on from this, let's just say, gouging of the American people when it comes to their health. And I'm encouraging my sisters and brothers on the conservative side, because medicine and the availability of everyone to have enough health care is universal. It's not by political parties. And the Democratic Party is the only one that will make an effort to do it. It will not happen in 1 month. It may not happen in 1 year. It may take a while. But we have to have fighters out there who are unwilling to compromise or to fight for as much as we possibly can get. And the best way to do that, again, is to vote unendingly blue.